Hello viewers, my name is Dr. Catherine Siengo Mutisia. I am a consultant psychiatrist. Today we will be discussing work-life balance among healthcare workers, and in particular at this time of COVID-19 pandemic. My office is at KMS Center, 3rd floor, 302 Mara Road, Upper Hill. I also work with the medical board for assessment for fitness for further service. And in that board, we've seen healthcare workers who have had severe mental health issues being presented for evaluation. And it's important to have these discussions so that we can know how to balance work and life. And some of the other roles I do, I'm also the Vice Chair of the Royal College of Psychiatrists, African International Division. I work at Mathare National Teaching and Referral Hospital, which is the biggest hospital for mental health problems in Kenya, and with many healthcare workers. And we've seen ourselves evolve from when the first COVID case was diagnosed in Kenya. We went through the first wave and now the second wave, and hopefully that we won't face a third one. And as we talk about work-life balance, we need to understand that studies done show that many healthcare workers, and especially doctors, do not have a balanced work-life situation. And one of the studies I will be giving links to showed that a third of physicians are dissatisfied due to lack of time for themselves or their families, with average life expectancy about 10 years less. It also showed that depression is about 4 times higher among physicians than the general population. The same study also showed that 8.6% that physicians are at 8.6% higher risk of emotional exhaustion, leading to burnout, with 10% of them having burnout. What about suicide, which is actually the worst outcome of untreated depression? We know that the same study showed that physicians' rate of suicide is 3 times more than what is recorded in the general population. We also know that 10% of physicians end up developing alcohol and other substances use disorder, what is commonly referred to as addiction. Again, the same study showed that only about 30% are satisfied with their work, and it was worse with the physicians working in the armed forces, which showed a percentage of about 40% not satisfied with their work. And those are the links you can read through the studies. Now let's define work-life balance. And when you're talking about work-life balance, we are talking of dividing the time you have between work and family or leisure activities. And when you're referring to work, we are talking about your career and ambitions. When we are talking about family and leisure, we are talking about activities geared towards your health, towards your pleasure, towards your leisure, and towards the spiritual aspects. So it's very important to try and balance the two. What are some of the causes of imbalance of work life? We know that when COVID-19 pandemic was declared, we noted that among healthcare workers, there were increased responsibilities at work, because look at the time you spend putting on PPEs and sourcing them and having to remove them. But again, we also saw that as some health workers were getting infected, they had to go into isolation, already causing strain among the few numbers of healthcare workers we have in Kenya. So that means there is increased responsibilities at work. We also saw that some hospitals, as the economy went down and their incomes were affected, they let go some staff and ended up with thin working staff, making the staffs who are already there have increased responsibilities at work. What about at home? We've seen that at home, our children have been at home longest. In Kenya, most of the schools are still only having the final year classes at school. So we have the younger children and those in middle school still at home with us. And for healthcare workers, that's even worse because they have to go to work and they leave their children unattended. We also have some schools offering online classes, and so for healthcare workers, have their children with screens at home, computers, phones to log into their online classes without supervision. So that calls for increased responsibilities at home. We've also talked about longer working hours, personal mindset. Sometimes your mindset thinking that, and depending on how you are socialized, that I have to work hard and make more money to prove that I'm a good person. And this, we see this a lot among men, the pressure to perform and using standards which belong to other people and not your own standards. That can also cause work-life imbalance. What about social media? We know healthcare workers, and not just healthcare workers, generally, as the use of social media increases, we find that you could be thinking you're having too much work, but when you evaluate, you find that a quarter of the time you spend at work, you're on social media. I read a study yesterday in one of the papers that Kenya has been shown to be leading among the use of social media groups in Africa. That means many Kenyans are spending a lot of time on social media. So you could be thinking you're having too much work, yet you're spending a lot of time on social media. At home, you could go home and instead of talking to your family members, you're busy on social media. So that can also cause work-life imbalance. What are some of the issues we should think about when you're talking about work-life balance? We need to talk about burnout. We know the best way to manage burnout is to prevent it. And you get to know you have burnout when you start getting disinterested in work, feeling that you're not making a difference, feeling anxious when you think of going to your workplace, feeling that your opinions at work are not listened to. And if burnout is not managed, it could lead to actual mental illnesses like anxieties and depression, sleep problems. So it's also very important we learn how to manage burnout. Time management is very key for work-life balance. I've just said you could be spending your time on social media and thinking your work is too much. Managing marriage and family, very key to the side of life because we are talking about work-life balance. And it's also very key to factor in retirement. I know when you're beginning to work, you might wonder, why should I be thinking of retirement and I have so many years to work? But we'll be looking at why you need to start thinking of retirement immediately you start working. Managing burnout. When burnout are setting, you actually need to evaluate your options. And I will give an example of what is happening to healthcare unions at this moment. They're actually discussing with their supervisors. We have seen KMPDU, we've seen the nurses organization discussing with their employers to see how they can deal with the stress of health workers not being able to access personal protective equipment, health workers not being able to access treatment when they unfortunately contract COVID-19, and the anxiety among healthcare workers, especially when they see their colleagues dying of COVID-19 infection. So when you're faced with burnout, you need to evaluate your options, discuss with your supervisors and see whether the issues bothering you can be addressed. And if that doesn't work, you might decide to start looking at the options you have. You need to seek support. And when you're looking at support, you could get support from your colleagues. We know that if you start comparing healthcare workers, you start comparing yourself with other people working in other sectors, you might get disappointed because you might find yourself working on a Sunday, for example, when everybody else is at home. You might find yourself working on a public holiday when other people are at home. You might find yourself working at night. So it's very important you also seek support from colleagues who understand what you're going through. seek support from your family members, seek support from friends. Try and get a relaxing activity. Many people, healthcare workers, give up on their hobbies. It's very important to keep up in touch with your hobbies. Every one of us as a child in us who wants to play, so we need to keep in touch with that. Remember to exercise. If possible, exercise daily, and make sure that you incorporate exercise into your life. You could actually use stairs instead of using the lift. You could park your car far from where the stairs or lifts are, and make sure that as you do your work, you incorporate exercises in it. Sleep is very important, especially for healthcare workers who sometimes work in shifts. And so you might have done a night shift, and then you find that you have to reset your mind again to when you have to do a day shift. So if you're not getting sleep, please consult so that you can be given a sleep aid. I'm assuming that by the time you even go to see a doctor, that you're engaging what we call sleep hygiene, where you make sure that you're not watching TV or screens late in the night, that you're not taking coffee at night, that you're not using the bed for TV and other activities, and that you're exercising during the day to be physically tired. So for you to get sleep, you need to have what we call good sleep hygiene. And if you're doing that and it's not working, there is also meditation. If you go online, there is an app called CBTI, that is Cognitive Behavioral Therapy for Insomnia. It can help you improve your sleep, and it's a free app which you can download onto your phone. And also, as part of managing burnout, there is what we call mindfulness, where you make sure that you stop to get in tune with what you're feeling. You stop to listen to your breaths. You stop. Imagine the way when you are on the road, you have to stop and look at the traffic lights. When it's red, you stop. When it's green, you proceed. So you also have to treat your body the same way. At times, you may need to stop and listen to your body. What about time-saving techniques? Apart from making sure you don't spend a lot of time on social media, paperwork. Depending on where you work, you might find, apart from your clinical duties, you also have some paperwork to handle. And those in private practice, you have insurance forms to fill. Those who are employed, we have many hospitals who are moving now from paperless to online systems like Cranium, where you put everything online. So you need to control your paperwork, where you either action on it, file, or throw it away. Many doctors and healthcare workers are too busy to remember to do their KRA returns, their tax returns, and they do it as last minute. So you need to do some of those some of that paperwork early, so that you don't get overwhelmed last minute. Delegate your job. You have healthcare workers who spend the day doing a lot of strenuous work, and when they go home, they still have to cook, clean their houses, and generally even manage their laundry. So if you can afford it, please remember to delegate some of those duties, or even managerial duties. Try and see what you can delegate. Learn to say no to some invitations. You do not have to say yes to everything. So every time you are faced with something to do, analyze and ask yourself, do I need to do it? Can someone else do it? Is there a quicker way, or is there a way to do it? Now, talking to women, because I'm a woman, and women find themselves with a lot of things to do, with a lot of caregiving to give. You are working as a doctor or as a nurse or any other healthcare worker, and when you come home, you still have to take care of your children. You may need to be the one planning for meals. You need to be the one planning for school activities. So this is to the women, and I came across this tweet which I found quite useful. And the tweet says, "Dear women, if you can get a housekeeper, please get one. If you can get a cook, please get one. If you can get a driver, please get one. Always look for easier ways to do things. Your womanhood should not be about suffering. Normalize luxury in your life, preserve yourself. So sometimes because of the way we are socialized, you grew up knowing that you should not be lazy, you should be doing all the housework, you should be making sure that everybody is happy in the house. So for women, we have to normalize luxury in our life and make sure that even as we work, we can actually trade the money you are getting to be able to get some luxury in your life so that you don't overwhelm yourself. What about marriage? We are talking about work-life balance. So your spouse is very important, and you're not happy at home, you can't be happy at work. So remember to find time to spend time with your spouse, quality time, not time watching TV, not time discussing children, not time discussing finances or where to invest. Find time to do fun activities together, respect each other, treat your spouse as your most important VIP patient. Some healthcare workers, and especially doctors, nurses, you might find that the way you treat your patients at work, especially the VIP patients, you treat them with so much respect, but when you come at home, the way you are treating your spouse, your children, is very disrespectful. So you should always remember to treat your spouse as your most important VIP patient. What about children and healthcare workers? Remember that everybody wants their children to learn values. Everybody wants their children to succeed in life. Everybody wants their children to be happy. Of late, we've seen stories of where teenagers are found partying and using drugs and engaging in sexual activities. And these children left home, went for a sleepover most of the time. So it's very important that we supervise our children. Even if we are doctors, you're still a father or a mother. So we need to make sure we have time for our children. And a simple way of making sure that you are there for your children, make sure you have a meal together every day. It could be breakfast, it could be dinner. Plan fun activities once a week. I know COVID-19 restrictions have removed many of the activities we would have done, but you can jog together, you can take a walk, you can play board games, you can watch a comedy together. There are many things you can do with the children depending on their age. You can even go to the park, Nairobi, especially Nairobi, although I know these talks are for everybody across the country, that you can drive to the national park, and there are many activities you can do. Discuss with your children and ask them what they would like to do. Make sure children meet their relatives periodically, attend family functions, and help children honor family traditions. We can get too busy and we have no time to remember to get in touch with our extended families. What about retirement? I said that when you start working, you need to start planning for your retirement. This is because we will be looking at where will you live after retirement. Right now, you might be paying your rent because you are earning. What about the time you will not be able to retire? You need a home to be able to live in. Healthcare services, you are paid for the service you give. What about the time you are too old or you are sickly to be able to work? How do you earn your income? So you need to also invest and get passive income generating activities. So some of the things to remember to factor in when you're thinking of retirement include what would you do if you didn't have to work for a living. So you need to get in touch with your hobbies. You need to do things for fun, not necessarily for work. Where would you want to live? Those are the questions you need to start asking yourself when you start when you start to work. How will you use your time so that you remain productive and inspired? Want to be close to your children or away? And remember that as we become urbanized, the traditional way of expecting children to take care of their parents is slowly dying, and therefore we need to plan that we have enough savings and we have enough facilities to take care of ourselves when we are old. What role will your family play? This is very key, and that's where we are talking of work-life balance. There are people who have spent all their time at work, and when you retire, you go home and you are a stranger. Nobody knows you. Nobody can identify with you. So that's why you need to create time for your family so that you can actually be able to engage with them and you can have a relationship. Remember, with love, love is spelled T-I-M-E, time. So if you love somebody, you have to find time for them. You have to find time for your spouse. You have to find time for your children. Again, you need to arrange for possible decline in health as you consider retirement. Because as you get older, you tend to get more health-related problems. And we know even now, many healthcare workers are not able to afford healthcare services where they work. Many are not able to afford insurance, medical insurance. So those are things we need to look at, and especially when you are not able to earn, you need to be able to still have income to pay for your medical insurance and to pay for your out-of-pocket healthcare needs. We also need to look at what life balance is not. It does not mean that there must be equal balance across all aspects of an individual's life. Sometimes you might spend more time in work. Sometimes you might have to spend more time at home. For example, when children are young, you might be spending more time at home. When children grow and leave the nest, you might have more time at work. Again, before you get married, when you are single, you will have a lot of time to develop your career. When you get married, then you have to create time for your spouse. So work-life balance is not static. One's balance varies over time as time changes depending on the current life situation. Work-life balance will be different for each person. It is not a one-size-fits-all situation. So you don't look at your neighbor and start comparing yourself to them because your situations are different. What is the take-home message then? We need to enjoy being a healthcare worker. We need to look at it as a purpose. Remember, when we talk about good mental health, we are talking about, are you able to reach your potential? Are you able to touch the community and contribute towards the community? Are you able to relate with other people? Are you able to do what you are meant to do? So if you are a doctor, you are a nurse, you need to be able to enjoy being one, and you need to be able to get in touch with that and enjoy being a healthcare worker. Focus on the sunny side of it. And again, effective time management is key to work-life balance. We talked about time management, very important. Remember to separate working time and home time so that when you go home, you don't have to continue working, and work short of causing burnout and know when to retire. Remember that we said the best way to manage burnout is to prevent. Even if you end up suffering burnout, we can still manage it, but the best thing is to prevent it. Remember, you are a human being first before you became a physician, before you became a nurse, before you became a healthcare worker. So make sure that you remain a human being and incorporate the physician bit in it. So for more information, you can look at our website at nairobiparentingclinic.co.ke, and you can also reach us through those emails. We are based at KMS Center, 3rd floor, Mara Road, Upper Hill, and we also have an inpatient facility in the same place, KMA Apartments, Block E, 5th floor, where we have affordable inpatient mental health services. Thank you very much.